The placenta is a really neat organ. It's actually an organ of the baby's, and it does some really important functions for pregnancy and for your baby. So this is the side of the placenta that is attached to your uterus. After baby is born, in the third stage of labor, you are going to give birth to the placenta. Now, placentas are usually pretty easy to be born. They're soft and squishy. They slip right out. They don't have bones like a baby. And so it's a much easier process. Plus, you'll be loving up on your baby at that time. And so you may not even be aware, other than some mild cramping that you feel when you need to push the placenta out. Now, what I want you to notice is the size of this placenta. Now, my placenta here is a model placenta. It is not an actual placenta. An actual placenta is sometimes slightly bigger than this, maybe more like the size of your face, okay? Either way, it is a relatively large organ. And when it comes off the wall of the uterus, you've got a wound there. That's the size of the wound that's left before the uterus starts clamping down, and that's where some of our bleeding is going to come from, and that's got to heal so that, and that healing occurs during in our postpartum period. That means with a vaginal birth, after baby is born, we are taking at least 2 weeks to allow that site to heal. If we have a cesarean birth, then we are allowing 6 to 8 weeks for that site plus the surgery site to heal from. Why? Well, if this wound were on the outside of my body, let's say I had a wound this large right here on my shoulder, there's no way that I would say, I think I feel pretty good. I'm going to throw a load of laundry in, or I'm going to run the vacuum cleaner, or maybe I'll cook dinner tonight. No way, because it's visible and we would know better. We would know that that is not a good thing to be doing. But because this wound is now on the inside of our body and we cannot see it, and if we are feeling relatively good after birth, we tend to forget about it. And what happens when we are not following those recovery instructions of taking it easy for 2 weeks? Well, our bleeding increases because our body is angry with us for not listening. Now, typically your instructions are going to be after the birth of the baby that you, as the person who gave birth, your only responsibilities are going to be self-care. So taking a shower, brushing your teeth, using the restroom, eating the food that somebody else prepared for you. And if you're breastfeeding, you will be feeding the baby. That's it. So vaginal birth, 2 weeks of doing just that. Somebody else has to do all of the other things that are responsible in your home, including taking care of you. All right, so back to the placenta here. Just want to make sure that we're getting that point out that you need support and rest and healing after the baby because of the size of this wound that is left. All right, so this is the site that's attached to the uterus. Coming off of that is this amniotic sac. There's actually 2 sacs, an inside and an outside, or I shouldn't say 2 sacs, but more like 2 membranes. It's all attached in one sac. Sometimes the outer layer breaks and the inner layer is still intact. We don't know what's going to happen there. And we also don't know when your water might break, but that's a story for another time. We're focusing on placenta right now. So if I flip this amniotic sac inside out, we're going to reveal the side that is for the baby. This is a very silky, soft side to the placenta. So your baby is laying against this very silky and soft pillow during pregnancy. You can see all of the wonderful blood vessels in here. We call this the tree of life. These blood vessels are helping to filter the blood between you and baby. Here is the umbilical cord, right? This is your baby's lifeline. Inside the umbilical cord are 2 arteries and 1 vein. The job of the placenta, with the help of the umbilical cord is to provide your baby with gas and nutrient exchanges. So remember, your baby is floating in amniotic fluid right now. Your baby is underwater in a very warm, tropical, sterile bath, right? So your baby is not breathing oxygen through their lungs the way you and I are. That means only half of your baby's heart is actually working right now, because the half that's not working is associated with taking in oxygen through our lungs, which your baby's not doing. Your baby is not eating food through their mouth and digesting it the way we do. Everything is being done through this placenta. It's also supplying your baby with rich red blood cells as well. So all of this exchange is going on between the placenta and your baby. This this umbilical cord is approximately 20 inches long, which is the exact length between where that placenta is implanted in the uterus to your breast. Your baby was not designed to go anywhere else after birth except right onto you. So baby is born, baby is going to be placed right on your chest, and you are going to be skin to skin with one another. Skin to skin is a wonderful way to warm the baby, and we're going to learn more about that later in this course. Baby is placed skin to skin. Now, baby has been born, they're on the outside, and all of these things that weren't previously working now need to start working on their own. Up until this point, placenta has been doing that job for the baby. At birth, placenta will continue to do that job and will continue to pump 1/3 of your baby's blood volume to your baby, while baby takes the minute here to make the necessary adjustments to life on the outside. So once that heart, the other half of that heart starts working, it's going to shunt off the supply from the umbilical cord and the placenta. Their guts are going to start working. Your baby's going to take a nice deep breath of oxygen. They probably are going to gag a little bit, spit a little bit, cough a little bit, sneeze a little bit, just to clear out all the fluid that has been in their lungs, all part of the process. Meanwhile, the placenta is still supplying your baby with oxygen-rich blood so that your baby is not oxygen deprived during this process right after birth. You will notice if you look down at the umbilical cord will be thick and blue, and I encourage you to go ahead and touch it. If you touch that umbilical cord, you're going to find a nice, strong pulse. And that's telling us that the baby is still relying on the support of the placenta right after birth. When the baby has made the transition and everything is working appropriately, then the baby is going to send a signal to the placenta and say, I don't need you any longer, my friend. And what will happen is this umbilical cord will drain. It will become, instead of thick and blue, it will be thin and white, and it takes a little while to get to that point. And then you will see a gush of blood, and the placenta will peel off the wall of the uterus, and the placenta can be birthed. Once we know that the baby no longer needs the support of the placenta, the umbilical cord can be clamped and cut. Now, what I've just described is called delayed cord clamping. Delayed cord clamping is waiting to clamp the cord. Now, I've described delayed cord clamping as watching the cord, watching the baby, and following the baby's lead as to when it is appropriate to cut and clamp that cord. Some providers will say, I delayed cord clamping for 30 seconds, or I delayed cord clamping for 1 minute. They never look at what the transition is that's happening. So if you have a very strong feeling about what delayed cord clamping might look like to you, whether you want to do it according to the number of seconds or minute, or if you really want to watch the interaction with the baby and the placenta and then cut the cord, you need to make those wishes and those directions specifically known. So define what delayed cord clamping looks like to you with your provider. It's also a great time to ask your provider at your prenatal appointment, what does delayed cord clamping look like to you? And let them explain. So you'll know whether or not your provider is looking at the baby or looking at their watch. Now, ACOG, which is the American College of Obstetrician and Gynecologists, says that we should be allowing delayed cord clamping for a minimum of 30 seconds, and that by 3 minutes, most of this transition has taken place and it would be appropriate to cut and clamp the cord. So it is a little bit of a gray area. It gives some sort of guideline, but it doesn't say cut the cord at 30 seconds or cut the cord at 1 minute or cut the cord at 3 minutes. It is simply saying this is what the overall process might look like, and the baby needs at least 30 seconds of that.